everyone. Thank you so much for joining us. It's Savannah here, Marketing Director with North Star Senior Advisors, and I have with me here Dr. Albors with Bluestone Physicians Group. And today, actually March 30th, happens to be National Doctors Day. So I wanted to sit down with the wonderful Bluestone and talk a little bit about the COVID vaccine, because I know that's a huge topic on everyone's mind right now, and just get some questions answered. So Dr. Albors, thank you so much for joining me today. We really appreciate it. Tell me a little bit about yourself.
My pleasure. Yeah. Hello everyone. I'm Dr. Albors. I am an internal medicine board certified physician, and I've been a physician for the past 20 years. Most of my career I've been doing teaching what we call academic hospitalists and being part of teaching residents and teaching medical students, and for the past year I've joined Bluestone Physician Services.
Oh, very good. Very nice. And just a little background about North Star. We do help seniors locate different senior living options in Central Florida. It's a complimentary service for those that are looking. But tell me a little bit about Bluestone Physicians Group and what services you offer.
Okay, well, we have offices in Minnesota, Wisconsin, and in Florida. What we are a mobile clinic in a way, so we assist patients that reside at assisted living facilities and group homes. So our model of care is residential. We visit the patient at their home, and our goal is chronic care management for the chronic conditions. We want to make sure that patients, they have a follow-up. We usually see patients every month, and we manage all their needs regarding labs, x-rays if they need. We can help them get appointments with specialists. We can get them services with home health, hospice care, and things like that. So they will have, especially now with the pandemic, it's become very useful, so patients don't need to leave their facilities to go to doctor's office for appointments. They don't need to leave their facilities to go get lab tests or x-rays. So we bring the care to their home, and we have a lot of success trying to avoid complications from going to outside clinics and exposing themselves to these illnesses. And it's pretty convenient, and it's good for the doctors too, because we see the patients every month. We get to know them, we get to know their families. We have great communication tools so the family can communicate with the doctors, with the nurses. We have a whole team of people working in the background, so they will help us with referrals, they will help us with orders, they will have enrollments. So I'm pretty happy I made the move, because I think this is an area that there's a lot of need for, and we're feeling that home.
Very nice. Yeah, no, this is a great service that you guys offer, being able to go into the home, like you said, not have to leave. So that's actually wonderful. Yeah. Well, you know, speaking of the pandemic, I definitely wanted to discuss the COVID vaccine. Again, it's been rolled out for a few months now, but there's still so many questions that we get from our clients, and honestly, even my friends and family just want to know more about it. So right now, who is eligible to get vaccinated, first of all?
Okay, so the vaccine at the beginning, we've already been vaccinated for a month or so. We have some different type of eligibility types. And at the beginning, we started with elderly patients, older than 65, and healthcare workers. But this has been changing so fast. So now I can tell you about Florida. Now beginning on next Monday, March 22nd,
I think it is.
Next Monday.
No, 29th. No, I'm so sorry.
March 29th.
March 29th.
We were lower eligibility to 40-year-old patients, and we already getting the teachers the vaccines, the healthcare workers, the firemen, all the essential personnel that are already eligible. But this is going fast. We're getting needles in the arms of people, and this is really being a success. So sooner than later, the eligibility will drop to 18 years of older. We expect to be there by April 2021. So we've been going faster than I expected, but that is great news. We need to get people vaccinated to be able to overcome what we all been through the past year.
I agree. It's very exciting to hear that 18 and up can now get it. hopefully next month.
Yes.
April. That's awesome. So where can they go to get vaccinated? Where can we go to get vaccinated?
Okay. So we have different types, and I can give you later some websites that you can go to, especially Orange County websites and Florida vaccine websites, where you can put your location and they will tell you where to go. But at the moment, we have the counties will give you places to go. We have the pharmacies will give you places to go, and we have the FEMA sites where the Federal Emergency Management Agency are putting some places so you can go to. But the easiest way to know where you need your vaccine is to visit the Florida Health website or the Orange County website and put on your location. It will tell you the eligibility options, so you will know if you qualify at this moment, and then you can schedule your appointment through them.
And so you can find the link to the link she is referring to below us here. We'll have it down for you. So thank you again for that information. And so after you get the vaccine, are you immune afterwards, or can you still pass it on to others once you receive it?
Okay, when they did the research for this vaccine, their primary goal was to make sure that people that get the infection would not get seriously ill. Because this was fast track, we still don't have the whole information about if we are not able to pass the vaccine, the infection to others. So that's why you still hear, yeah, you will get immunity when you get your vaccine, but we cannot guarantee yet that you will not get the infection. So what you hear is that even though you got the vaccine, you still need to wear your mask, wash your hands, and keep your distance, because we don't have the full data yet to tell you you're not gonna get infected. So yes, there's a small possibility that you can still get infected and pass it to others, even though you don't have any symptoms. I'm expecting data to come later, because the research is still going, and we will get more information with time. It's still too early to know what happens in 6 months after getting the vaccine, but when we get to that moment, we will have the information for you. Things are looking really good. The data that we have, preliminary data, tells us that some of the vaccines will prevent you from getting sick and passing it to other, but not, we don't have, the full information at this moment. So yeah, you will be immune. You can get the infection, but you will not get seriously ill. You won't need to get hospitalized, and it will save your life. But you can still get it. Most likely you won't know it, but you can still pass it to others. So please keep wearing your mask, keep your distance, and wash your hands until we instruct otherwise.
Very good. Yes, definitely still wear your mask, right? Very good. And so also with the vaccine, are there any side effects from, when you receive the shot? Has there been any cases?
Well, I don't like to call it side effects.
Okay.
I like to call it reactions. And these are the reactions we want for you to have. They could be a little bit uncomfortable. So you've been hearing about reactions to the vaccines. They're benign reactions. When you get your first dose, you can get swelling in the arm, you can get redness, you'll get some pain when you move it, but it will go away in a day or two. When you get your second dose, usually the symptoms in younger people are a little bit more severe because they develop a stronger immune response. And what I mean for that is that you can get fever, body aches, headaches, chills, but those symptoms usually only last 24 hours. So I will get those symptoms instead of getting the COVID for sure.
Right.
Some people can take Tylenol, just rest. Know that you're gonna feel a little bit down after getting your second dose, but it will go away in 24 to 48 hours. So the benefits of getting the vaccine by far outweigh the risk of getting the infection.
Very good. Yeah, I have been hearing, it's interesting that you said that younger people may have a stronger reaction, because those that I've spoken to that are younger seem to have maybe a little bit more reaction, as you mentioned. So that's good to know. And it sounds like there's only 2 shots that you receive, is that right?
Well, we have 3 vaccines available.
Okay.
There's the Pfizer, there's the Moderna vaccine, and there's the Johnson & Johnson vaccine. The Pfizer and the Moderna vaccine, you need 2 doses for them to be completely effective, because that's the way they did the research. The Johnson & Johnson vaccine is only 1 shot.
Okay, good to know. Very good.
And we have all of them available here.
Good, very good. And so I know there's been a lot of hesitation around getting the vaccine just because of people are worried. There's a lot of misconception out there for getting the vaccine. Would you say, or how would you say, to kind of alleviate those concerns about just some of the fear, I guess, of getting the vaccine?
I heard different things.
Yeah.
Some people think that they develop it too soon. So they don't trust something that just came out of the blue. And I wanted to touch base on that a little bit if we have time.
Mm-hmm.
We are in the middle of the pandemic. This affected the whole world, not just the US. So we needed to act fast. So this was a worldwide effort. All the scientists around the world were putting their own mind into getting a vaccine. It was just not a one country problem. So with all those scientists, they found out that this mRNA was already being used for other problems. They were trying to do a vaccine for tumors, for cancer. So the technology and the science was already there. They just used it for something different. Mm-hmm. So this vaccine is special because it's different. It's not a live virus. You're not gonna get the COVID virus by getting this vaccine. It's not even an attenuated virus like other ones that we use. It's just a piece of genetic material that tells your body what to do and how to create immunity. Mm-hmm. So yeah, it's new. Yes, it's different, but we were really fast in getting there because we have help from all over the world. And there were a lot of people infected, so we had no shortage of individuals to use the vaccine with. I can tell you about the Pfizer vaccine. They used 44,000 people, got these, were enrolled in this research for this vaccine, in these trials. And that's a lot of people, 44,000 people from around the world. They did it between Germany and the US. So they got a pretty good amount of people to try it on, and the efficacy and the effectivity was 95 to 97% to save you from getting sick and dying from this infection.
Wow.
Other people will think that because it's genetic material, it can get into your body. That doesn't happen. What you get is a piece of RNA. Yes, that is genetic material. It's encoded by a lipid. It's like a fat, so it can get into your body. And that is like a piece of paper with instructions for your body to produce something. So I like to say the corona vaccine is like a virus that has a crown. Corona means crown. Mm-hmm. So what the mRNA vaccines make is you just inject the instructions and your body will start producing this crown, right? And your immune system will recognize this crown as something that's foreign, and it will develop immunity. So whenever they encounter a virus with a crown, it will know you don't belong here, we're gonna get rid of you. These instructions that are injected into your body will not get into your cells. It's just a piece of instructions for your body to build something. And it's degraded as soon as your body starts creating these spike proteins, what I call the crowns, or the spike proteins in the virus. It will just go away and you won't find it anywhere in your body anymore. What you will find is these proteins that signal your body to create the antibody immune response. So if you get exposed or infected, you will have the tools to fight.
Very, very good to know. I know, as you mentioned, one of those misconceptions was that it would alter your DNA, so it definitely does not do that.
Definitely not. No way.
Yes, no, that's good to know. And so if someone were to get COVID, how long should they wait before they get the vaccine?
Okay, so when you get COVID, of course your body will know this is a virus, this is a pathogen, and we will fight it. The thing with COVID is not everybody gets the same reaction. Some people will get it with no symptoms. Some people will feel like a cold, but some people will get a systemic inflammatory response, and that it's a strong immune response that will end up taking you to the hospital on respiratory failure. The COVID virus can affect your lungs, your brain, your heart, every organ, and we don't know who's gonna get really sick and who's gonna have no symptoms. With the same is when you get the COVID, your body will create immunity. But this immunity is not going to be the same for everybody that gets the virus. Like it's not the same that not everybody gets the same symptoms. So we don't really know how long the immunity you develop is going to last. We will know that eventually, but we assume and we know, it's not an assumption, every time you get an infection, your body will react and create a response. But we know that you will at least have some protection. We just don't know how long. So for now, the CDC recommends that if you have the COVID, you wait 90 days before getting the second dose.
Okay, good to know, very good to know. So there is a little bit of a waiting period and you'll be
But you can still get it if it's available. They say 90 days at the beginning because the vaccine there was shortage of the vaccine. But we've been getting a lot of new, a lot of vaccines. The productions, it's really advancing. So as we get more, we'll be able to get to more people. There's no need to wait 90 days anymore. It's just a precaution when there's a shortage. You won't get sick if you get the vaccine before 90 days after you got the COVID. And I had some patients in assisted living that have received the vaccine after having been positive for COVID, and we haven't seen any adverse reaction of getting it sooner. But the current recommendation is to wait 90 days.
Good. Very good to know. Thank you. Really, my only other question is there has been a lot of discussion about variants of the vaccine or COVID itself. So if some were hesitant to get the vaccine because of the variants and they were thinking maybe to wait longer before a new one would come out that I guess would target those variants, do you recommend waiting for that? Or
Definitely no.
Okay.
Definitely no. Every virus mutates. So we were expecting to see variants. It's nothing to be scared of, but, especially because we have so many people studying this virus. And right now, the information that we have is that those variants are covered by the current vaccines we have. If there's gonna emerge a new variant that the vaccine is gonna not work, we will know about it. And the pharmaceutical companies and the scientists will figure it out, and maybe you'll get a booster in the future. We still don't know. What we know is that you need to get the vaccine as soon as it's available to you. It doesn't matter which one of the three. The three of them are 97 or more effective to saving your life. The effectiveness may vary between one or the other, but I will tell you, do not look at those numbers because all of them will prevent hospitalizations and death. Regarding variants, I would not wait at all.
Okay, no, that's good to know. Yes, so you heard it from her. Probably not good to wait. So thank you so much for your time today. All of these answers were super helpful because definitely common questions we get often. So I really appreciate your time today.
My pleasure.
And happy National Doctors Day.
Thank you. And thank all of you.
Thank you so much.
Bye-bye.